Thank you, everybody, for taking time out of your busy schedules to attend today's webinar, Living, Working, Dying, Demographic Insights into COVID-19. I'm Dr. Noreen Goldman, the Hughes Rogers Professor of Demography and Public Affairs at Princeton University. I am pleased to be your moderator and discussant for this timely event. Today's webinar is sponsored by the Population Association of America with support from the Association of Population Centers. PAA is very grateful to the Office of Congressman David Price and his legislative director, Nora Blaylock, for circulating a Dear Colleague letter to promote today's event. PAA is a professional association comprised of over 3,000 population scientists, including demographers, sociologists, and economists, who are conducting research on the individual, societal, and environmental implications of human population change. Population scientists, including today's panelists, rely on funding from the nation's scientific research agencies, especially the National Institutes of Health and National Science Foundation, to support their research. They also rely on data produced by the federal statistical agencies to inform their interdisciplinary policy-relevant research activities. As you will soon see, the research featured in today's briefing provides good illustrations of the integral role federal scientific and statistical agencies play in the field of population research. The population research community has responded quickly to the COVID-19 pandemic, redirecting research efforts and resources to understand this public health crisis. Applying their unique expertise, population scientists have focused on how socioeconomic and demographic characteristics, such as race, ethnicity, gender, and income, influence both the onset and severity of the disease and the short-term and long-term implications of the pandemic. So let me now move to my slides. I hope you can all see them. And they're not exactly where they're meant to be, but okay, that look good? Okay, so let me begin by mentioning today's speakers. As you can see, we'll share research findings from Dr. Mark Garcia at the University of Nebraska, Dr. William Scarborough, the University of North Texas, and Dr. Anna Gassman-Pines from Duke University. These speakers' complete bios are posted. The link is shown on the slide to give you more information about their expertise. After this event, you'll receive a link to the speaker slides, which will be posted along with the recording of the webinar on the PAA homepage. Let me note now that speakers are not here to express or advocate for specific policies. Any positions they may express are their own and do not necessarily reflect positions taken by the PAA or the co-sponsoring organizations. The speakers have each been given 10 minutes and they are being timed. I will moderate a question and answer session after I have discussed the panelists' presentations. So if you have questions, please post them at any time in the chat box. I will summarize the questions and ask appropriate panelists to respond. When you post the questions, please state who you are and what organization or media outlet you represent. And before we move on to these speakers, let me show you a summary of results from a recent paper written by myself and my colleague, Teresa Andresfay, that measured the disproportionate impact of the pandemic during the year 2020 on life expectancy at birth for the Black and Latino populations. You may have seen the media attention given to this paper. Some of these headlines focused on the decline in US life expectancy being over 1 year in 2020, a really mammoth decline. But the focus of the paper was on the racial and ethnic disparities in that decline. So let me show you one slide of results. There's a lot of activity on this slide. I'll try to take you through it. First of all, let me note that a decline of life expectancy for the entire US population in the year 2020 of what we estimate, as I show you on the right of the slide, to be 1.3 years is indeed an extraordinary decline. One could contrast it with what were declines of 1/10 of a year just several years ago that were attributed partly to the opioid epidemic and caused consternation among academics and the media. Okay. The other thing you can see from the slide which takes the trend in life expectancy at birth for these various groups and then shows in the dotted line what happened in 2020, you can see the very large decline for Blacks and Latino populations, as well as for what is now a much larger gap between the Black and white populations. So when you look at these numbers, let me point out three things. One is that these estimates, and these are updated estimates that my colleague and I got from updates from the CDC, are just for 2020, and they're based specifically on deaths that are attributed to COVID. Okay, some deaths were not attributed to COVID inaccurately, and other deaths occurred because of delays or failure to obtain care altogether for important chronic diseases, and so were indirectly attributed to COVID. And we know that these deaths would increase estimates like this by somewhere between 25% and 35%. So these are probably large underestimates of the decline in life expectancy due in just 1 year, the year 2020. They also reflect a huge setback. So if you look at 2020 and you go back to where the line was at a similar point, you can see that we're talking about life expectancies the US experienced perhaps 15 years ago will match what we will see in just 2020. Okay, and finally, let me note that the largest decline among the groups that we looked at for the year 2020 is for the Latino population, a decline of just over 3 years in life expectancy at birth. And with that note, I will turn the talk over to Dr. Garcia, and I will stop my sharing now.
Okay, thank you very much for that introduction. To begin with today, the title of my presentation is COVID-19 Mortality and the Economic Well-Being of Black and Latinx Americans. Before I begin with my results, I'd like to acknowledge my collaborators on these ongoing projects, Rogelio Science at the University of Texas, San Antonio, Adriana Reyes at Cornell University, and Amy Theory from Xavier University. I would like to begin by presenting provisional mortality data from the Center for Disease Control and Prevention to document deaths by age and race and ethnicity. First, I will begin by presenting ratios of non-white age-adjusted death rates to white age-adjusted death rates for both COVID-19 deaths and non-COVID-19 deaths from January 2020 to April of this year. As we can see from this figure, adjusted for age, Latinx and Black Americans have between 2.4 and 1.9 times more likely to die from COVID-19 than whites, which is much higher than the non-COVID death rates illustrated here. Note that the lower ratio for non-COVID-19 death among Latinos is a historic phenomenon known as the Latino Paradox that we could return to later in discussion if anybody has questions. Next, I'd like to note when examining the disparate impact of COVID-19 mortality among racial and ethnic groups, it is important to recognize that there are large differences in the population age structure of these groups. For instance, the Latinx population in the United States has a median age of 30 years compared to a median age of 34 years for the Black population and 44 years for the white population. This figure here illustrates that both Latinx and Black Americans have experienced a larger number of COVID-19 deaths at younger ages compared to the white population, who has experienced the vast majority of COVID-19 mortality among those aged 65 and older. Next, I would like to illustrate COVID-19 death ratios by age and race ethnicity. As with the previous slide, Black and Latinx Americans are disproportionately impacted across all racial categories relative to whites. I would like to note that Blacks and Latinx, particularly in working age groups, 15 to 54, have a ratio that is 3.5 to 5 times higher than that of whites. Next, I would like to transition to the economic and well-being of older Black and Latinx adults in the United States. For the next part of this presentation, I use data from the 2020 COVID-19 module of the Health and Retirement Study to document how the COVID-19 pandemic and subsequent economic recession has been particularly detrimental for the economic well-being of older Black and Latinx adults. As we can see from this figure, older Black and Latinx adults have been particularly disadvantaged compared to whites with regards to reduced income, increases in household spending, and the number of economic hardships experienced during the pandemic, with US-born and foreign-born Latinx particularly disadvantaged in the number of economic hardships relative to older non-Latinx white adults. Viewing specific economic hardships, we can see large racial and ethnic differences across a host of economic indicators, including missed payments for rent and mortgage, missed payments for debt, utilities, medical bills, and also a lack or trouble purchasing food. So, what does all this tell us? First off, the ongoing pandemic has affected all individuals in the United States. However, it has not affected all groups in the same way, evident from the results I have presented today. I argue that the COVID-19 pandemic has exposed the nation to the stark reality that structural racism is a driver of health disparities in the United States and has exacerbated pre-pandemic disparities in health, mortality, and economic well-being. I will not go through all the points listed here, but I will note that structural racism is a root cause of the social determinants of health in this country. Thus, it is not surprising that older Black and Latinx adults have been disproportionately impacted by the COVID-19, given the longstanding structural inequalities, such as exposure to disproportionate employment of individuals in occupations deemed essential, the lack of sick leave or the ability to work remotely, as well as environmental hazards associated with densely populated areas, crowded and multi-generational housing, and high poverty, not to mention the increased exposure through public transportation. And also that the COVID-19 disparities experienced by Black and Latinx communities are exacerbated by the lack of healthcare access and quality of healthcare among those populations. This contributes to COVID disparities, including missed or delayed diagnosis and treatments, as well as a higher risk of severe COVID-19 and mortality. Healthcare access barriers include lack of healthcare coverage, quality of healthcare, language barriers, delays in seeking care, and racial biases in COVID-19 testing and treatment. These challenges are particularly stark for the undocumented Latinx population. Finally, I would like to conclude that at the beginning of this pandemic, the previous administration, as well as much of the media, portrayed the disparities highlighted here as individual level factors related to inaccurate racial and ethnic tropes, such as abusing drugs and alcohol and other negative individual health behaviors, ignoring the many risk factors that increase minority exposure and susceptibility to negative COVID-19 outcomes that are rooted in structural racism. Moving forward, it is imperative that federal, state, and local governments continue to collect and release comprehensive data by race and ethnicity, such as the data presented here today, that emphasizes the intersection of health, place, and equity to better gauge the impact of COVID-19 among minority communities. Thank you very much. With this, I'd like to pass it on to Buddy Scarborough.
Let's see. Okay, great. Well, thanks everyone for joining this webinar. And thanks to the PAA staff for organizing this and Noreen for moderating. I'm really excited today to talk to you about a body of research we've been working on over the past year. The title of this presentation is Rising Gender Inequality During the Pandemic, Documenting Challenges and Highlighting Solutions. This research I'm going to talk about has been conducted by myself, Caitlin Collins, Liana Kristen Landivar, and Leah Reppener, and it's been supported by the Russell Sage Foundation. There are 2 points I'm going to cover in this talk today. First, I'm going to discuss growing gender inequality during the pandemic and 2 of its primary sources. Then I'm going to highlight some policies that have been empirically shown to be effective ways to reduce gender inequality during the pandemic. First, let's review some data on rising gender inequality during the pandemic. Over this past year, we've seen the worst economic crisis since the Great Depression of the 1930s. Many of you have probably seen a graph like this or something like it over the past year several times. To reiterate again, we've seen from January 2020 to April of 2020, the US lost about 25 million jobs. When we look at gender differences, we find that while both men and women lost jobs, women lost over 1 million more jobs than men. Although employment has grown since its low point in April, these gains have still not helped us catch up to where we were prior to the pandemic. And in many ways, economic hardships have been faced by women much more than men. In fact, employment is just one indicator. When we look across multiple outcomes, economic outcomes for women, we find that they have been affected disproportionately by men. They've reduced their work hours 4 to 5 times as much as men. They've received fewer wages and occupational advancements and promotions over the past year. And part-time and contingent work has grown more for women than men. So what's driving some of these trends that we're seeing, the rising gender inequality over the past year? Well, one reason is that the industries where women were more commonly employed were the ones that were most heavily hit by the pandemic and the associated lockdowns. The industry of leisure and hospitality, where a slight majority of women are employed, has lost more jobs than any other sector. Education and health services is another sector that's been hardest hit by the pandemic. In this industry, 75% of workers are women. So these patterns of industry level segregation have predisposed the pandemic to have a large effect on gender inequality. When we look at industries where the majority of workers are men, such as manufacturing or the information sector, we find much lower levels of job loss over the past year. So this is one factor that contributes to gender inequality, but it doesn't fully explain it. Even when we look at industries with equal shares of women and men, such as retail trade, where 48% of workers are women and 52% are men, we see that more women are exiting the labor force than men. To explain these trends, we have to look at what's going on within families over the past year. When we look at that, we cannot ignore the tremendous challenges that the loss of childcare and in-person schooling has posed to working families. Without childcare support, it's incredibly difficult to balance employment expectations alongside the major rise in childcare demands. Prior to the pandemic, mothers performed the majority of childcare. Although fathers' contributions have increased over the past year, they have not done so as much as the increase in mothers' time spent on childcare. Under these strenuous conditions, something has got to give. And what we found over the past year is that thing that is giving is mothers' employment. Data from the Household Pulse survey from last summer shows that 1 in 3 non-working mothers cite challenges related to childcare as the reason why they left the labor force. In comparison, only 1 in 8 non-working fathers cite childcare concerns as a reason for leaving work. This means that mothers are 3 times more likely than fathers to leave the labor force to address growing childcare demands during the pandemic. So in summary, when we look at gender inequality over the past year, it's really created this sort of perfect storm of gender inequality. First, industries where women were the most represented were the hardest hit by unemployment and job loss. Second, the loss of childcare has pulled many mothers from work in order to address these large demands. As a result, we've seen a major decline in women's labor force participation and a return to traditional caregiving arrangements in the family. These 2 factors threaten to erase many of the gains we've had in gender equality over the past several decades. If we just look at women's labor force participation, we can already see troubling signs. Not since 1987 has women's labor force participation been as low as it is today. In other words, the recent data show that the pandemic may have taken us back 30 years in some indicators of gender inequality. These trends may snowball into other patterns as well, such as gender wage gaps or differences in managerial representation. The good news is that social science research can give us a pretty good idea of what we can do to address these current challenges and mitigate further inequalities. My co-authors and I have shown that programs like Head Start and childcare subsidies from the Child Care and Development Block Grants can play a large role in improving mothers' employment. As the availability of these programs improves, mothers are able to maintain their employment at higher levels. But Head Start currently serves less than half of all eligible children in the US, and childcare subsidies are available to less than a fifth of those who are eligible. So this means there's ample opportunity to expand these programs and the benefits that derive from them. Another source of family support that we took for granted over the past year was in-person schooling. We know remote schooling was often a necessary, but nonetheless major challenge for working parents. But remote schooling was not uniform across the US. Collecting data from over 9,000 school districts, my co-authors and I found major variation in families' access to schooling. Oftentimes, neighboring communities had different instructional modes. We found these various reopening statuses had major consequences on families. Mothers' employment was 5 percentage points higher when in-person schooling was available compared to when only remote schooling was available. Thus, in-person schooling served as a major resource for families. But this resource was not equally accessible. Mothers' employment was about 70% of predominantly white schools were in-person compared to about 40% of Black and Hispanic serving schools. These differences may lead to growing racial disparities in years to come, if not addressed through equitable investments in education. Lastly, when we turn to the recovery in the future, we can learn from the last economic crisis that we experienced during the 2007-2009 Great Recession. During that period, states with more expansive Head Start programs experienced a less dramatic rise in poverty and a more stable recovery. This is because Head Start offers a crucial form of support for families and allows them to maintain employment and economic stability. I want to close with 2 primary thoughts on what is important in addressing rising gender inequality during the pandemic. First, we need the tools to identify these inequities. This means further investments in research and federal data products, such as the Current Population Survey, the Household Pulse Survey, and the American Time Use Survey. Second, the evidence we have strongly points to the immediate need to invest in public resources that support affordable and accessible childcare. Programs like Head Start are extremely valuable for children's development and offer major supports for families, particularly mothers, to maintain employment. Thank you very much. I look forward to your questions, and now I'm going to pass it on to Dr. Anna Gasman-Pines.
Thank you so much. I'm really pleased to be here today and to get a chance to share data that I've been collecting along with my colleague Elizabeth Ananat on hourly service workers with young children. Dr. Ananat and I were conducting an ongoing daily survey from a sample of about 1,000 hourly service workers with young children between the ages of 2 and 7 in Philadelphia who were recruited in the summer and through the fall of 2019 before the pandemic. The original goal of this study focused on work schedule unpredictability and worker and family well-being. Consistent with being service workers with young children, this sample is largely women of color, and families who had relatively low income even before the pandemic started. In our ongoing daily survey, we asked these working parents about their work and home experiences and their well-being via basic SMS text messages every day for 2 weeks. And by mid-March, we had enrolled about 700 of our original sample of participants. What we were able to see is that these working parents' work and well-being decreased as soon as restrictions related to the COVID pandemic were put into place, including the closure of schools and the closure of non-essential businesses. So in this figure, the orange line is the share of these folks who were working each day. The blue line represents a composite of family mental health. And what you can see is that as soon as the COVID restrictions were put into place, these parents' work fell dramatically and quickly, as did their well-being. Once the pandemic began, we pivoted our study to start asking about it, and we collected data throughout 2020, including in the initial crisis phase beginning in mid-March through late April, where our early work showed at that moment in time very high levels of job and income loss, caregiving burden, and material hardship, as well as alarming levels of psychological distress. Our second round of data collection was in May and June of 2020, and a third round in September through November of 2020. And so what I'm going to share with you next are a series of findings that paint a picture of what was happening with these hourly service workers with young children throughout the year of 2020. First, we found substantial increases in food insecurity during the COVID crisis. So prior to the beginning of the pandemic in February of 2020, already these families were struggling with food insecurity. 24% of our sample indicated in February that they were worried about running out of food, and 22% indicated that they had actually run out of food because they did not have enough money for food. As you can see, throughout the rest of 2020, once the pandemic started, these rates of food insecurity increased substantially. And this is consistent with national data from the Census Pulse survey that has also shown very high rates of food insecurity throughout the pandemic. Among those in our sample who were still employed in April, their income from work, that is their earnings, has been relatively stable since June. So in a series of figures that I'm going to show you, the dark red reflects income losses of more than half, more than 50% compared to prior to the pandemic. The pink bars are income losses of less than 50%. The light green represents stable income, and the dark green represents increases in income. And so for those folks who were able to maintain employment, they have experienced income losses from earnings, but those have been relatively stable throughout the pandemic. For those who were unemployed in April, income losses have been even larger, and if anything, have grown over the year 2020 as the pandemic has persisted. In May and June, supports from government programs aimed at stabilizing family income during the pandemic did help buffer all families from large income losses. So in this figure on the left are the parents who were employed in April in the early part of the pandemic. On the right are the folks who were unemployed in April. The leftmost bars are, again, the income from work, that's earnings. And on the right is income from work plus supports from the government, including expanded unemployment insurance and stimulus payments. And in both cases, the extent of income losses decreases when families considered the income support that they had received from government programs in response to the pandemic. However, these programs were temporary, and that buffering effect had faded by September. So by September, for both the employed group and the unemployed group, income losses looked quite stable over time. When considering supports from government supports. Additionally, it's very important to consider that benefits were not available to all, even when they should have been. So here I'm using unemployment insurance as an illustrative example. Of all the workers in our survey who were laid off, 87%, nearly all, tried to apply for UI. Small numbers said that they thought they weren't eligible or that it seemed too difficult. Of those who tried to apply, nearly all, 95%, got through the application process. However, of those who had successfully applied, at the point that we surveyed them, only 62% had actually received their unemployment benefits. And of those, only 84% had received their expanded unemployment compensation as part of the government pandemic response. It's also very important to note that these experiences are not equal across different groups. So actually successfully applying was lower among our Hispanic respondents who perceived that they are ineligible for UI. Further, actually receiving unemployment conditional on successfully applying was lower among our Black respondents, whose benefits were simply less likely to have arrived by the time we surveyed them. Additionally, we document in our work chronic mental health struggles for these families. In fall of 2020, nearly half of the parents in our sample had screened positive for major depression, generalized anxiety, or both. And 17% of parents report that their children are sad or worried the majority of the time. One factor in these mental health challenges could have been the chaotic schooling and care situations in the first half of the school year. So in the first half of the school year, we fielded another daily survey, and we found that disruptions to parents' care or school arrangements were incredibly common, with nearly a quarter of families experiencing a disruption to school or care on any given day. Additionally, family well-being is negatively impacted on days when there is a disruption to school or care, including increasing children's uncooperative behavior, increasing children's being sad or worried, as well as affecting parents, increasing parents' anxious or depressed mood that day, and the likelihood that they will lose their temper with their child. So taken together, the implications of these findings are primarily that continued supports for working families and the school and childcare facilities they use are needed. In terms of work and income, the December extension of expanded pandemic unemployment compensation was a very important first step, and the additional stimulus rolling out now will help even more. But more attention is needed to ensuring that all families, and especially of families of color, receive the benefits for which they are eligible. In terms of mental health and other supports, we all need to be thinking about ways to strengthen systems addressing family mental health and investing in additional family supports, as well as looking for additional ways to aid schools and childcare centers. To conclude, the effects of the COVID crisis on hourly service workers with young children on work, income, and well-being were immediate and striking. And the effects on families have persisted as the pandemic has persisted. Policies aimed at providing income to families during this crisis did help, but their reach has not been universal, and little attention has been paid to family mental health needs. Additional public supports will help these families in need. Thank you so much, and I'd like to conclude by thanking the federal agencies and foundations that were able to fund this work. I will now turn it back over to Dr. Goldman to moderate the Q&A.
Thank you. And while I get my slides back, let me ask you, everybody, as you put your question into the box, please give your name and your affiliations. Okay. So let me begin, first of all, by thanking our three speakers for very informative and very interesting talks. What I'm showing you on this slide are the data sources and funding sources for just the talks that you've heard in the last half hour or so. So it's rather an impressive set of federal statistics and federal funding that's allowed these researchers to present what you've seen today. You can also see from Dr. Gassman-Pine's talk that researchers are collecting their own very timely data to fill in the gaps and obtain more in-depth information when the classic data sources don't provide the kinds of information that we need, very timely information during the pandemic, and use newer data collection platforms such as iPhones that let us get at things that we haven't been able to get at in the past. Okay, so what I'm trying to do in the next couple of slides is pull together the main points from the several talks that you've heard. And one of the big points here is that the effects of COVID are wide-ranging, they're long-term, and they exacerbate existing inequalities. All of the talks have made that kind of point. First of all, let's talk about increased mortality, very closely linked to reduced life expectancy. COVID-19 deaths are especially high for the Black and Latino populations. And the effects on life expectancy are particularly high for these groups, both because of large numbers of deaths and the fact that the age of death tends to be younger for the Black and Latino compared to the white population. How do these excess deaths come to be? They come to be both because these groups have greater exposure to the virus, greater infection rates, and because they have greater disease severity that ultimately leads to hospitalization and, unfortunately, mortality. Okay. When we talk about life expectancy effects from 2020, which I showed you were dramatic, that doesn't include what we call these excess deaths, deaths due to other causes that may have well been due to the delayed or foregone care for conditions that happened during the pandemic, but people were unwilling to seek medical care for fear of infection, or that care was inadequate, emergency rooms were overrun, etc. So really that impact on life expectancy, we don't fully know now, we will know soon, but it's even more horrifying than what you've seen here. In addition to affecting mortality, of course, COVID has affected health. The talks here haven't focused on physical health, which of course is a major impact of COVID and long COVID in particular, but worsening mental health, as Dr. Gassman-Pines has pointed out. We're talking about increased depression and anxiety among parents, and focusing in particular among mothers who have had the juggling act to a greater extent than fathers, and increased worry and uncooperative behavior among children. Oops. The third point of these talks has been the kind of economic hardship that families have faced. And again, it's especially true for the Black and Latino populations, and it's also especially true for women, regardless of race or ethnicity. And it comes about in several ways. It comes about by people losing their jobs, by people reducing the degree of their employment, for example, from full to part-time, and by people having reduced income within their jobs. And a lot of that, particularly for women, is driven by the fact that they have increased childcare responsibility as childcare centers have closed, as schools have gone remote, as there's been kind of a ping pong game going on with openings and closings. Okay, and one totally devastating consequence of the many consequences of reduced employment and income has been food insecurity. As well, which has led to a substantial fraction of these populations actually facing food running out on them. And I should also mention that these economic hardships, although they are across the board, have been faced by more than half of the Latino population. And I should probably say now, and should have said earlier, that I'm using Latino, that word synonymously with Hispanic. Okay. And the final topic of these talks in terms of the COVID-19 consequences has been the disruptive, inadequate childcare and schooling. Okay, there have been huge impacts of this, both on children and parents, again, especially the mothers. It's affected health, it's affected the education of children, and it's affected the gender division of labor, with women disproportionately facing this kind of juggling act and having their professions or their employment suffer as a consequence. And another consequence that was mentioned briefly is that there's a likely increase in racial ethnic disparities in educational progress, because that closing of schools has not occurred equally across the country. Okay, finally, let me mention two more things. All of the talks have talked about the need for policy supports during these crises, and the fact that the supports that have existed have been very helpful. There's no doubt about that. But they've also been inadequate in their amount and in their duration, not always covering the periods that people needed, not lasting long enough, and sometimes not targeted at the groups that needed most. And that's been another consequence, that these policy supports have been least likely to reach persons of color. So what is the longer term outlook of all of this? Of course, we would all love to know the answer to that question with conviction, but it depends on the duration of the pandemic, which depends in large part on the success of vaccination programs and the generation of new variants of the virus. And it also depends to a large extent on our economic recovery. But what we can say with a fair amount of certainty is that the impacts are not likely to disappear quickly. We won't be back to normal within months. Not only that, we are facing huge setbacks that we can talk about in terms of not just single years, but more than a decade. In terms of women's employment level, Dr. Scarborough pointed out that we're talking about levels that the US faced more than 30 years ago in 1987. In terms of life expectancy, I showed you some numbers. My colleague and I went ahead and calculated the impact of life expectancy in 2021 based on just the first 3 months of data. That's all we have. We're still in April. And just those 3 months suggest a 0.6-year reduction in 2021 from pre-pandemic. Okay. And the racial and ethnic disparities that we calculated for 2020 are also apparent in the 2021 data, which haven't yet been released in terms of anything close to final estimates. So when you put that together, and you put that together with the excess deaths the US faced during this pandemic from causes as diverse as diabetes and Alzheimer's disease and the opioid epidemic and heart disease, we're talking about a setback in terms of life expectancy at birth of at least 20 years as of today. And of course, despite our success in vaccine rollout, the pandemic is far from over in terms of its impact on infections, hospitalizations, and mortality. So on that very discouraging note, I open the floor for questions. And again, let me remind you to put your name and affiliation along with your questions into the box. Okay. So, So we have a group of questions that I will try to paraphrase and direct. Okay. Some of which I can see have actually been answered by our panelists who are so quick on the gun. But so there's a question from Robert Valdez, who has asked, and I think this would go to Dr. Scarborough, how has the loss of jobs in the service sector during the pandemic contributed to the difference between men and women being pulled out of the workforce? And the discussion of childcare does not necessarily follow from all of this. So let me pose that question to you, Dr. Scarborough.
Great, thanks, Noreen. And thanks, Dr. Valdez, for your question. I think that raises a really important point. We don't have any estimates, for example, like a decomposition analysis or something like that, that could tell us yet. It could be done, we haven't done it yet. The degree to which job loss in the service sector accounts for some of the trends that we're seeing. But I think the evidence presented thus far in my talk definitely speaks to that. We saw most jobs were lost in industries that were majority women workers, leisure and hospitality, education and health services, for example. We know patterns of industry and occupational level segregation mean that women are disproportionately employed in service sector jobs. And we also know that women of color are disproportionately employed in low wage service sector jobs, especially in the care sector. And these are parts of the economy that have been really, really affected by the pandemic because it's care work, which means interpersonal contact, emotion work, these kind of things, which were shut down during lockdowns. So yeah, definitely service sector job loss during the pandemic plays a large role. But I think childcare does also, the loss of childcare is fundamental. It's not exclusive, it's not mutually exclusive from the economy. I mean, there's a lot of economists, Nancy Fulbray, et cetera, who talk about how essential care work is to the economy. And when we look at the data, when we look at men and women in the same industry or in the same occupation, we find that women are more likely to exit due to childcare concerns than women. My co-authors and I have published a piece that looked at men and women employed in only telecommuting occupations, right? Jobs where both, under the pandemic, where both mothers and fathers should be at home, working remotely, and with elementary school age children. And we found that mothers' work hours reduced 3 to 5 times as much as fathers' work hours under those conditions. So, you know, care work is part and parcel of the economy, but care work is disproportionately done by women. And we're seeing the consequences of those inequalities come to the surface during this pandemic. So, and then your last point I see there, Dr. Valdez, I'll just answer this quickly, I don't want to take up too much time, is that schools have acted as daycare all too often rather than educational institutions. And I think those aren't mutually exclusive. I think we like to think of care work as I noted earlier, as something separate from the economy, but it's very important to it. And oftentimes we sort of relegate care work as less valuable. And that's a big reason why care work is underpaid. And I'm an educator, I'm a professor at a university, and I consider myself a care worker because I care for students. And I think educators in our K through 12 public education systems do that as well. And it does function as a key part of our economy through operating from whatever the school day is, 8 o'clock to 3 p.m. It's not 9 to 5, but there's extra supports for that to coincide with the conventional work hours. Of course, that leaves hourly workers and those with non-conventional work schedules marginalized. And Dr. Gassman-Pines spoke to that, I think. So yeah, I'll leave it off at that. Thanks, Dr. Valdez, and I'll send it back to you, Noreen.
Okay, so I'll go ahead and pose a question to Dr. Gassman-Pines. You have incredibly valuable survey data that you collected that look at the mental health impacts of the pandemic. I wondered whether you were able to look at how much those varied across racial and ethnic groups.
Great question. We have been able to look at that. And in general, what we find is that our white parents report the highest levels of mental health problems, and the Black parents report the lowest levels of mental health problems, with the Hispanic parents kind of falling in the middle. But I think what's most important to note about that is that's actually quite, well, there are two important things to note about that. One is that's actually quite consistent with general mental health surveillance numbers, even from before the pandemic. And second of all, that all groups have seen an increase during this pandemic, both in general and that in terms of the results that I showed about worsening kind of daily mental health on days when there are disruptions to care and schooling, we see those are actually also consistent across all groups. So even though there are between group differences, all families in our sample have experienced stark increases in mental health problems.
Okay, thank you. And while I encourage all of you to continue to put your questions into the box, because our panelists have been so good at typing responses, let me pose a question to Dr. Garcia. So a surprising finding from my own work, and it's also reflected in your work, is the very high COVID mortality among Latinos overall, and particularly in the younger age groups. That's occurred despite the fact that they have lower smoking rates than other groups, and they have lower rates of many, although not all, chronic diseases compared to the white and Black populations. So we know that poor access to healthcare would have a big impact potentially on the death rate, but probably much less so on the infection rate from COVID. So what do you think are the most important factors driving this exceptionally high mortality among Latinos? Do you think it's frontline work, crowded housing, something else? What's your take on it?
Well, I would say that it is a combination of exposure from essential workers, frontline workers. As a matter of fact, there's recent research by Lisa Riley and her colleagues from the University of California in San Francisco that highlights exactly these questions, looking at the mortality rate among Latinos in California, where they have more comprehensive data by country of origin, by nativity status, by gender, that we do not have nationally. And their findings highlight that among those with higher exposure and higher mortality, this is largely due to those who work in essential industries and also those with lower education as well as the foreign-born. I would also say that despite the rollout that we have, the vaccination rollout by the Biden administration, recent evidence by the Kaiser Foundation highlights that Blacks and Latinos are 1.6 less likely to have received one dose of vaccination compared to their white counterparts in the United States. So what we need to do is we need to do a better job at getting these communities that are at higher risk vaccinations. And part of it is because specifically among older adults, there's a preponderance of evidence that shows that Black and Latinx adults have higher disability and also higher prevalence of Alzheimer's disease. And one thing I would like to highlight that a recent report by the CDC states that COVID-19 mortality rates by underlying condition, that individuals with dementia account for 32% of these deaths. And when we talk about dementia, population-wise, Blacks are 3 times more likely and Latinos 2 times more likely to suffer from Alzheimer's disease than whites. And this is also a significant contributing factor to both exposure and mortality among these groups.
Thank you. So I wonder, do any of the speakers want to raise questions to any of the other speakers?
I'll pose a question. Thanks, Noreen. Mark, I have a question for you. Is to what extent do you think geography might come into play through like patterns of residential segregation in some of the findings that you've uncovered?
They, I would say, play a very significant role. As we know from prior research, that Latinos, the dispersion of Latinos and the African American population in the United States varies by region as well. So what we know, what the evidence shows us, that approximately 50% or over 50%, I should say, of the Latino mortality has occurred in California and Texas, which has large proportions of Latinos. But there is also emerging evidence that suggests that areas that have a larger proportion of Black and Latinx individuals have both higher infection and higher mortality rates due to COVID-19.
Okay, thank you. We have a question from Corey Johansson for Dr. Gassman-Pines. She's interested if you have information on what the parents report about their child's well-being, and are you considering including follow-up from the perspective of the children?
Thank you so much. So we have been asking parents to report about their children's well-being since the study began in late summer and fall of 2019. So what we've been able to do is both compare in general how are parents reporting about their children's behavior during the pandemic compared to before the pandemic, as well as during the pandemic, how does child behavior vary on days when families have different experiences, like their schooling or care arrangement was disrupted compared to days when things went smoothly. So we are very committed to continuing to collect information about child well-being. The children were between the ages of 2 and 7 at the beginning of the study. So now they're between the ages of 3 and 8. And so for the older children, there could be some ways of gathering information from them directly, but for the younger children, we still need to rely primarily on parental reports or reports of other adults in the children's life to get a sense of how those children are faring.
Thank you. So let me pose a question that any of you could answer, or maybe all of you could answer, which is, what additional data collection efforts could the federal government help support that could inform our understanding of the social and economic consequences of the pandemic? One example that's been given is that the Department of Education Institute for Education Science has proposed launching a school-based pulse survey to capture the implications of the pre-K to 12 level on students, teachers, families. Are there other kinds of data collection needs that would be very useful for researchers to have?
So I can start, and I'm very curious to hear from the other panelists as well. And this actually relates to the prior question. So a few thoughts around trying to gather information from a children's perspective. One would be really thinking about nationally representative surveillance data around child mental health, especially by age group. I think there's been a lot of concerns around adolescents in particular that we didn't get a chance to talk much about today, but I think some additional work on capturing child mental health. But relatedly, really thinking about focusing on ways of gathering data that tell us about the typical child's experience in the US. So most of our wonderful and extremely important surveys start with households or families as kind of the starting point, and then might gather information about children. But it might be really important for us to know something slightly different, like, well, what share of children in the United States have had a parent that lost a job during this pandemic? It's possible to get there by working with the existing data, but really thinking about some data collection that helps us really understand what's happening with the population of children in our country would be very valuable.
Thank you. To Dr. Scarborough or Dr. Garcia, does one of you want to address that too?
Yes, sure. I would like to mention a few things. I think there is mainly a lack of cohesiveness in data collection at the state and local level, apart from the federal level. So we could talk about all these disparities by racial and ethnic disparities, by gender and what have you. But it is important, intersectionality theory tells us that there are vast differences in the experiences that individuals have. As I previously stated, that although we are all going through the pandemic together, the individual experiences are very, very different. For instance, the experience of a white male is vastly different than the experience of a Black female in the pandemic for numerous reasons. And we need this data so that we could highlight the disparities that are specific to individual groups.
Thank you. So I have a question from Lele of Rutgers University. I'm not quite sure which of you would be best to address it. Perhaps Dr. Gassman-Pines. Many of you have talked about the lack of care for children. What is your take on the role of extended families in providing care? Does the availability of extended families contribute to racial disparity in children's outcomes, especially their mental health outcomes?
Sure, so I'm happy to start, and again, would love to hear from the other panelists on this as well. What we find in our study is that the parents who are most likely to be living with extended family are those parents in our sample who were born outside the US, and that's about 15% of our sample. And what I can say from what we've analyzed so far is that in the pre-pandemic times, we do have evidence that those extended family members were an important source of care, especially on days when parents had an unexpected change to their work schedule. So if a shift got added on at the very last minute, or a parent needed to stay late unexpectedly at work, we see that especially in those immigrant families, extended family members living in that household seem to be playing a very important role.
I would just add to that, in our research, I think I agree with Dr. Gassman-Pines, definitely plays a large role, but it's not a replacement for public childcare offerings like Head Start and childcare subsidies, just because oftentimes those who are in the most need of childcare don't have extended family members or sources of support, single mothers, and immigrant mothers who might not have local family or networks or something like that. So just to further emphasize, public care infrastructure is really central as well.
Thank you. So I should note that we're beyond our time limit. So officially the webinar is over, but if there are additional questions, our panelists have offered to stay longer and we'll take your questions. So thank you all again for attending this webinar. We appreciate your attention and your participation. And if there are additional questions, please put them in the Q&A. Okay, so for anyone deciding to stay, I have a question from Erin Bassetti for Dr. Garcia. Do you think the lower vaccination rates among minority populations is about equitable access to vaccines or general vaccine hesitancy, or both? What policies or practices do you think are needed right now to address this?
Right, that's a great question. And I would argue that it is a combination of the two. One of the things regarding equitable access is in the rollout of the vaccination, it has varied tremendously by state. And part of it, part of the obstacles for particularly minority groups is signing up. There's been a very complicated process through internet and what have you. So that's one factor. But another factor is that it is well established that older adults, those at higher risk, older minority adults, I should say, suffer from a higher rate or a higher proportion of disabled life. That is, they spend more time disabled compared to the white population. And because of these disabilities in transportation or ADRD related, there are difficulties in accessing the vaccination. And I think another factor is that we are giving a mixed message to the population. We are saying do not congregate in groups. However, when it comes to vaccination, we're asking the population to come to large facilities to take the shots, where that could lead to some of the hesitancy that many have described. And these are all contributing factors. But I will say recently, the Biden administration, through the American CARES Act, has offered tax relief for employers to allow their employees to take days off to receive vaccination, and also to deal with the side effects of the vaccination after they've received it, which is a very good step. However, there are still many populations, marginalized populations, that suffer from disability and also suffer from ADR, dementia. And there are issues with transportation, getting to and from the facility that we need to address.
Thank you. I don't see any additional questions at this point. Do any of the panelists have a burning desire to respond to any of the earlier questions that were addressed more broadly to all of you? Otherwise, I think we've gone beyond our time limit. And again, I thank everybody for attending, for watching, for contributing, and especially the speakers for wonderful presentations. And the PAA, of course, for its organizational skills in producing this webinar.
Thank you.
Thank you so much.
Thank you.
Are we officially off the air?
I don't know, it says live on YouTube here.
Why don't we all jump off and we will reconvene at another point to debrief. Thanks so much. Bye, guys.
Right.